smiling. We love you. And you know, and again, brush your teeth and tell yourself, and maybe we can come up with a song. I love myself. I love me so. I took myself to the picture show.
We need Alexandra May to write for us.
Right. But we got to do that. And all of that is about healing and about all the things that we need to do. And when we heal, when we're happy, guess what? Our immunity goes up naturally, right? We don't think about eating all those fatty foods like Dr. Saggu teaches us. Hello, Dr. Saggu. Hi.
Hello. Welcome. Namaste and Sashikar.
Namaste. Namaste. Good evening. But we got all of these wonderful, wonderful blessings in life that we need to count.
Before we start our special show talk with Dr. Saggu, I would like to thank you, Anandi Mai, for joining us today.
Thank you.
We would love to honor Thank you.
Please
thank you for such a beautiful conversation.
And do some.
We would like to.
Let's plan a Reiki session.
Sure. Of course, I'll do that. I would love to do an online meditation session for you all whenever you need.
That'd be great. Let's do it.
And it's time for talk show with Dr. Saggu, and this is what we do every Saturday with Dr. Saggu. Today we talk about fatty liver and obesity. So, Dr. Saggu, stage is yours.
Yeah. Thank you so much. Thank you, Kim, Ankit, and all of you, Jimmy. Thank you very much, Rakeshji. I think we have talked about a lot of things, and whenever we think that there is a problem with the liver, we always think about the alcohol. But I think now, along with that, this epidemic, you can say it is an epidemic. So two epidemics are going on alongside. One is the obesity, and along with that, the liver problem, or you can say the fatty liver. So this is a sort of epidemic. And we know very well that epidemic is an unusual occurrence of any disease in a community or in some part of the nation, or when the expected occurs in excess of that, so it is an epidemic, and it becomes pandemic when the same occurrence of the disease in excess occurs in large or widened geographic area, maybe some part of the nation, maybe some continent, or all of the world. So like the corona or COVID-19 pandemic is going on. So on the same basis, these two epidemics, they are going on side by side, that obesity and we can say the fatty liver disease. So basically the fatty liver disease, when there is a deposition of the fat is there in the liver cells, because we have small hepatocytes, and the function of the liver is, number one, the liver detoxifies the body. Whatever the toxins are there in the body, that is being detoxified or they are being excreted by the liver. Number two is there is some excretion of some medications. We can say the metabolism of some medications, some sort of the painkiller or some other antibiotics which we are taking. So they are being metabolized to the liver and being excreted. And number three is the synthesis of the bile juice that is helpful in digestion. And because of that, we can have a good digestion. So all three, the major function of the liver. When there is involvement of the liver cells, they are the hepatocytes, then they can check the normal function of the liver, and then only we say that our liver is going into the failure. There are certain stages of the liver failure. So first we need to understand what are the causes that can damage your liver. Yes, alcohol is there, but now we can say that there are so many risk factors like obesity is there, diabetes is there, or high fatty food is there. So all these, they are the risk factor for developing the fatty liver. So if there is a problem because of the alcohol, we say that it's an alcoholic liver disease. But when it is not because of the alcohol, we always say this is NAFLD, that is non-alcoholic fatty liver disease. In NAFLD, if we say that there is a deposition of small droplets of the fat in the hepatocytes, that is NAFLD. The fat droplets are there in the liver cells. The further stage, when these fat cells, they grow inside the whole of the cytoplasm of the cell. Then they pushes the nuclei of the hepatocyte on the one side, and then they can do the lysis of the cell. So the normal cells of the liver, they are being damaged by the lysis of the cells. Then the inflammation starts occurring in the liver. So first stage is always a normal liver. From there, NAFLD, there is a deposition of small droplets. We can say the medical term is steatosis. So this is called as steatosis. And when there is in steatosis, when there is a lysis of the cells and some sort of inflammation is going on, then when this lysis starts healing, so whenever there is a wound on our body, so when the wound heals, it leaves some scar tissue there. So on the same procedure, when there is a healing of the area in the liver, it leaves scar there, and because of the scar, the fibrosis is there in the liver. So the normal cells, they are being converted into the fibrosis. So we don't have a normal cell. The normal function of the liver cell is not there, but in spite of the liver cell, we have a fibrosis over there, and slowly, and this is known as steatohepatitis. So normal liver, NAFLD, that is a non-alcoholic fatty liver disease. When there is an inflammation because of the lysis of the cell, lot of free fatty acids or cytokines are being secreted, then it is known as steatohepatitis. And from steatohepatitis, some sort of fibrosis is occurring. And when the fibrosis goes into a higher extent, then it can lead to cirrhosis of the liver. So cirrhosis of the liver is the third stage. And then after the cirrhosis of the liver, it can progress to the hepatocellular carcinoma, that is a cancer of the liver. So we have seen from the normal liver cell, we have reached up to the cancer of the liver, and the whole process which is going on in between is because of obesity. So we can say the obesity can complicate each and every part of each and every organ of your body. So that includes liver also. Whenever we have fat cells, whenever we have a fat in excess in our body, so that our body has tendency to store or deposit that fat in all the organs. When it is in the liver, it is fatty liver. When it is a spleen, it is a fatty spleen. When it is a omentum, it is a visceral fat. When it is subcutaneous tissue, it is the adipocyte or adipose tissues. So the fat is being deposited and gives us a gift of the obesity. So we already have discussed about that. This obesity is a man-made obesity. Why this obesity is occurring? Why our fatty liver is occurring? Because of there is imbalance in the calories taken and between the calorie consumption or ingestion of high calorie food, ultra processed diet, high fatty foods, and low protein diet. So all these factors, they can lead to fatty liver. So when we see why this deposition occur, because whenever there is an extra fat or extra calorie in the body, they are in the adipose tissue, and from the adipose tissue, there are basically triacylglycerol are there in the excess of the fat in the cells, and from there, from the fat cell, from the adipose tissue, from the peripheral organs, through the blood, they reach to the liver, and in the liver, they become triacylglycerol, and they are being deposited in the cell in the form of triacylglycerol. And the function of the liver is they oxidize these TACs into VLDL, that is the very low density lipoproteins. So they convert into the lipoproteins, and from there we can excrete all those TAGs, and we can excrete all those fat cells. So this is the normal function. The fat is going from the blood to the liver, and the liver can convert into the VLDL, and VLDL is going into the blood. So there is no storage of fat. When there is a prevention, or we can check of any process, whether it is oxidation of the fat in the liver is being prevented, or excretion of the VLDL, or the synthesis of the VLDL is being prevented, so we can have a fatty liver also. So instead of having obesity, other factors are also there. If we are taking some sort of medications which prevent the lipoprotein synthesis, they can also lead to fatty liver. Some essential amino acids are also there, like methionine is there, which is helpful in the synthesis of lipoprotein. If we are not taking enough of good essential fatty acids, then there is a prevention of the synthesis of deprivation of synthesis of the lipoprotein. So then the TAG is being not converted into the VLDL. So then the extra fat is deposited in the liver. So I'm not talking about only in the obesity, but yes, in the starvation also. During the starvation, we don't have a good amount of essential fatty acids or amino acids. They are responsible for excretion of the fat from the liver. Even then, we can have a fatty liver. In excess of the carbohydrate in the food, the extra carbohydrate being converted to the fat, and then it goes to the liver. Then again, it can lead to the fatty acid. So excess of the carbohydrate in the diet, less of the carbohydrate in the diet also can lead to fatty acids, because fatty liver, because if we don't take carbohydrate, then then the fats is also being converted to the carbohydrate, and the carbohydrate can again give rise to the fatty liver. So both things are not good. Even the starvation can lead to fatty liver, or the obesity can lead to fatty liver. But the prevalence of the fatty liver in the obese people is around 66%. If once BMI is more than 30, then he is 66 to 70% higher risk of having a fatty liver. Because of alcohol, around 45 to 50% chances are there that the patient is going to have a fatty liver. If we combine both, if the patient is obese, his or her BMI is more than 30, and he or she is also drinking alcohol in excess amount, then the chances of having a fatty liver is around 96 to 98%. So this combination, obesity with the alcoholism, is not good. Almost you can say 95 to 100% cases, the chances of fatty liver is there. So how we can prevent this? We can treat the obesity, and always we can be aware of the diet. We should be aware of the healthy lifestyle, and we should know that what constituents of the diet we should be having in the diet, so that the fatty liver should not develop. So if you have a fatty liver, then definitely first and foremost is you have to change your lifestyle. You have to change your constants of diet. You have to change your pattern of diet. You have to change all the etiquettes regarding your diet and your physical activities. And if your BMI is very high, you can say 35 to 40, then definitely bariatric surgery is there to help to decrease the chances of fatty liver. So what we have seen, according to the data presented and because of the RCT studies, we have seen uh, uh, because of 60% loss of your excess body weight, it will give rise to 85% chances to disappearance of steatosis, and 75% chances the disappearance of the fibrosis in the liver. So by the bariatric surgery, by losing weight, definitely there are chances that you can reverse the condition of your liver, and there will not be chances of going into the liver transplantation.
Yes, sir.
Oh, right. So
That was interesting. Talk about liver and how we can procure and how we can still maintain a liver, and
Yeah.
what is fatty acids and how we can stay away from those. But the important part is that how we will balance it out. That is what important, because people can't avoid all those things as well. The culture and the food in India. So, what is the best way to balance the things?
We can always mix up in our diet, and we can always have some sort of physical activities, because in every field you don't have a win-win position. If you don't want to change your diet, at least you should start some physical activities. When you will start your physical activities, then automatically what the exercise, the physical activity is doing. The effect of exercise is, number one, it will increase your circulation. Number two, it will give you a good physical activity. Number three, it will keep you active. And number four, exercise will tell you to choose some healthy options of your food.
Yeah.
If you cannot start your healthy food, your exercise will tell you that which food is good for you and which food is not good for you. The exercise will make you disciplined about your eating pattern. The exercise will make you good etiquettes regarding your drinking. So
Yes.
exercise will give you each and everything. If we are doing good physical activities, automatically we are going to have a good and healthy diet.
Well, you don't want to do all that exercising and then put it to waste by eating bad. So, and one of the things that I'm disappointed in our society is we make it so easy access and cost effective to buy bad food versus the good food. Ankit and I are trying to get people to become ambassadors of good food. So we're starting ambassadors of fruit. But, and I think I'm going to become the ambassador of watermelon because that's my daily joy food.
Yeah,
But
yeah.
go ahead.
Yeah, I think if this I always say, I mean, uh, these are the big eaters, you can say. These are the crocodiles. So these all big corporates, they are the crocodiles. If they are doing their work, if they are advertising, I mean, the ultra processed diet, and we have already started our campaign. IBM TV is always campaigning every week to have a good and healthy diet. So if they can embark on that, crocodiles can embark on that, then we are also there. We have already started this campaign, and I think the campaign of this IBM TV will definitely help to make the people aware regarding the healthy diet.
It's so important and it's so easy. And the conversations have encouraged me. I mean, every day I come in here with watermelons and berries now, not junk food.
Yeah.
It's just getting the mind established. And, you shared with me, as well as one of the other doctors, to not eat after dark. I think we had this conversation with you about the liver, right? So my stomach was over COVID swelling. We have a tendency of eating after dark in my family. And I'm not exercising like I should because I'm doing other things. But my stomach was swelling really bad and I could not get it down. And when you guys told me to do that, I immediately did that. Like, Ankit and I go, we had to talk about it after the show. And I did it. And I kid you not, my stomach, the swelling, in 3 days, the swelling has gone down. So the whole family eats before dark now. We don't eat after dark anymore. And it's not going to go down 100%. I got to start working out more. But the swelling's gone. The swelling's not there at night. So there's something to that, not eating after dark. There's something there.
Basically, our digestive system is the mirror of our health.
It is.
So, the health of the body depends on the digestive system now. The digestive system is controlling each and every part of our body. Even it is controlling the brain also. If you give good food, actually in Indian culture, what we say, it's a sattvic food and tamasic food. Sattvic is a good food, is a healthy food, which gives a good vibration to your brain. And tamasic food is the food which will not give you good vibration. In spite of it, will give the negative vibration. So if you eat good, you think good.
Happy, you feel good. You're happy. Your mental state of mind is happier. I feel better because my body feels better. I mean, it's so simple. Why do they make it so difficult for us? They don't. But here's the thing: they teach us in school. The food pyramid. They teach us how to. In books. But at the cafeteria, I know India is different, but at the cafeteria, they don't serve us those good foods, right? We are served some, really not so good foods. And so I think that we need to be setting the examples. And like Ankit and I, we're going to get ambassadors of fruit. And
so I will be the mango ambassador, and Kim will be the watermelon ambassador. And we are looking for a lot of more ambassadors. You have to choose your own fruit.
You have to choose your
fruit. Anything you can give me. You can give me salad.
Salad. Okay, the whole bowl.
You can give me the veggies. Green veggies. Green veggies.
Oh, the whole bowl. We'll give you the whole bowl. And this is what we want. I think one day we're going to have a meal, like we're going to show people this is how you can use your watermelon. This is how you can do your salad. And the thing that you also emphasize is eat your salad before your meal, right? Eat it slow, chew it good.
Fill your stomach before eating. Fill your stomach before eating.
But you know what? The salad tastes better than the food sometimes, Yeah.
You can have a water also half an hour before eating. So that way you can clean your digestive system. Plus you can fill your digestive system also. So cleaning is also very important. There should not be any raw material over there. And in my OP clinic, almost every patient is coming with the fatty liver, and they will come and they will ask, "Tell me the drugs for that."
No,
I always tell, I mean, there is no drug. Just you have to change the level of your thinking. You have to take good food, and in the medication, yes, probiotic is very good. If the patient is taking probiotic, definitely he can have a good health of the liver. Change your diet, that what to eat, when to eat, how much to eat, and what not to eat. So these are the four principles of the life. Yeah.
we're so instant gratification. Everything has to be microwaved and peel. Right now, there's no pill for good health. You have to make our health. And yeah, I think give me a drug. No, eat well. There's your drug. Eat well. We're going to get a pill bottle that says eat well, not stay home. Eat well.
But to my surprise, Dr. Saggu, everyone is looking for those medicines and drugs. No one talks about fruits and vegetables and things like that.
No. Nobody wants to talk about that. Even for the weight loss also, everybody is ready to get the surgery done. But after the surgery, they start the same thing, and then they can regain the weight also, because body always tend to regain and not to maintain. Always tend to regain. Yeah.
And it's again, it's a mental mindset and learning to appreciate what goes into your body. We're taught a lot of interesting etiquettes, right? Etiquette, but before you, when you say hello to the prince or something, right? You bow. Or etiquette of before you drink a wine, you cleanse the palate, right? But you had mentioned something. Maybe it's a good idea to drink water before you eat. Why? To cleanse the palate, to cleanse your. So maybe we can start etiquette. Even
that one benefit of drinking water before eating, half an hour eating, is that it will take your whole of the saliva inside, and the saliva being an alkaline, it will neutralize the acidity of your stomach, and because of the food you will not have an acidity.
Wow.
So that is also an extra benefit of drinking water 30 minutes before you're eating.
See, nobody ever taught me this. It's kind of like financial literacy. No wonder we're unfit and financially and physically unfit. Did you learn this?
So Kim, there are a lot of things which happened from a recent times. People are following it up, but we are moving towards the Western life, and Dr. Saggu knows about it, and that's why we are in a big situation.
Basically, this was our culture. I can tell about the Indian culture. Maybe it's a human culture also, because we are born from only one person, and this is a culture that how you should drink, how you should eat. So this was in culture, and because of urbanization, this all bad things has happened, and now we can see the result also.
And Kim, Sir, we also need to tell Kim that, and all to our viewers as well, that we used to sit down on the earth and eat our food.
Yeah.
Not that you have to use the table, table or things like that. You have to go bend down. And
it is always good to.
Yeah.
It is always good to sit on the earth in the cross-leg position while eating. Yeah. So there are a lot of scientific.
Do that too. The Japanese do that as well. So it's when I dined with the Japanese, we did that a lot. So it's definitely an interesting way of doing things. We eat at the table, but my favorite way sometimes to dine is to go out on the back porch and sit with a plate and kind of sit. So I like to do that. So maybe that's very. What is the benefit of doing that? Let's just
basically. While sitting on the earth, we always say that you are more attached to the elements from which we have already made, because of the earth we have made of around 5 elements, and one of that is the earth. So we are more close to earth. That is the one. Number 2, while sitting in the cross leg, your abdomen muscles, they are more relaxed, and you can eat well. And number 3 is the gravity have a good attraction while sitting on the earth, as compared to when you are sitting on the chair. So you will not be having constipation, and your food will go very easily downwards your digestive tract. So these are few scientific reasons why we should be sitting cross-legged on the earth and eating our food.
No, these are
Dr.
good,
Sabu,
good ideas.
I have learned a good line. I mean, there was earlier Dr. Mansi was there. She was talking about dental hygiene, and then Anandi Mai was there. She was talking about mental health. So we discussed about a good phrase which is known as "food for your soul."
Food
So
for your soul.
what do you think about food is for your soul?
Because we always we are looking for food for our body, and we are eating all those things, maybe bad thing, maybe good thing, that depends on the person. And then the food for the soul is how you be aware of your nature, right? If you are breathing, at least you should be aware of the air, the pure air which is going inside. While taking bath, you would be aware of each and every drop of the water which is there. And
Yeah.
while you are sitting in the nature, you should be aware of the voices or chirping of the birds and the chirping of, you can say, the trees. So if we are aware of the outside environment, plus we should be aware of our inside environment also. So that is basically the food of our soul.
Wow.
That's beautiful.
The air we breathe is our food. You're right. Our oxygen. I mean, these are all the things that we need. And for people who smoke, I don't get it. That damages the body so bad, right?
We have all we yeah, we always have a value for the burger, we always have a value for the pizzas, we always value for the coke, but we don't have a value which has been given free to us, that is the air. We are not
Yeah.
paying anything for the air, we are not paying anything for the water, we are not paying anything for the earth. So a
Yeah.
lot of things have been given to us by the Almighty. So we are not praising that, and we are not valuing that, but we are valuing the bad things. So we should start value all those things.
And you know what? We got a good start now because COVID kind of cleaned our air for us, right?
Yeah.
So we got a really good blessing right now that we need to appreciate. Go out and breathe it every day. My favorite time to go outside is after it rains, right? After it, well, I like the rain too, but after it rains and that rain stops and it's not hot, right? It's kind of cool, and the air smells so fresh, right?
Earthy smell is very good after raining.
Yeah.
Yes, it is. I love the sound of nature after it rains, right? It starts to come out, the crickets and the frogs and everything. There's just so much that we can do in enjoying life that doesn't cost a lot of money. This is what is interesting to me. It's not a pill. And it's healthy and it's free. It's like you said, it's free. And we don't appreciate it. And those are the things we need to appreciate. You keep talking about the fatty liver, and what are the people who have a fatty liver or maybe have damaged their liver? We've talked about this before, but they can get it fit. I mean, the liver heals itself, right? That's someone was asking me. We have mentioned.
I would like to add one more point with fatty liver, that Dr. Saggu, we have two kinds of food: a warm food and a normal temperature food, or maybe a cold food. So, what kind of food is good for the body? Do we have to keep on warming the food? Is it good, or we just have to use the natural temperature and then consume it?
So there is always when we are going to, you can say ripen, or we can say cooked, both the things,
Okay.
right? Look,
Yeah.
look, we can take an example of fruits. If you take a ripened fruit, if there is a ripened mango, that would be more sweet. That would have more carbohydrate.
Okay.
That may have more refined sugar also. Instead of, there is less ripened fruit. So the the more ripened fruit has a more glycemic index. It means that that will be digested very easily, and it will go in the sugar will go in the blood very fast, and that is dangerous, right?
Okay.
So because when we talk about the calorie consumption, there we always have to balance the calorie taken and calorie consumption. So calorie consumption is not only the physical activity, it includes the thermic effect of the food. Thermic effect of the food is how much energy is needed for the digestion, absorption, and transportation of the food. So we should have to burn more calories for the digestion of the food. For the ripened fruit, the less energy is consumed. If the consumption of the energy is less, the more energy will be deposited and will give you the obesity. Same with the cooked food also. Well cooked food have easy and early absorption. The less energy is being consumed, and when your energy is burnt less, then you have more tendency to deposit that extra calories. So that is why we always say that we need to have a salad that is a raw. Raw vegetable is very good. As much as raw vegetable you can take, that is very good because the absorption is very slow, and you will feel full also. When that raw vegetable is there into your digestive system, you will not need to have more food. That will give you more satiety and less hunger. So that is why the less cooked food is good, less ripened fruits they are good. Even you talked about the warm also. We should not be cooking so much. We should be cooking moderately, and we should not be warming again and again. Because if you warm your food again and again, that will also increase the glycemic index. And if you increase the glycemic index of any food, that is not good for your obesity, for diabetes, or for something else, for the fatty food, for the fatty liver.
That's interesting. That's very interesting. I had no idea because we have a tendency of rewarming our food, leftovers, right? So I'll just be more careful about that. I got a question for both of you though. What's your favorite vegetable?
I take my favorite vegetables are the green vegetable. I take pumpkins also, and all salads I like, and I like ladyfinger also,
Wow. And
and
Kit, what's your
spinach and
favorite?
spinach.
And spinach. I love spinach. Yeah, I love spinach.
I like green vegetables. Spinach is what I like. I like potatoes, tomato. There are different kinds of vegetables. I mean, and we cook in different ways in India actually. So there is always a good, and I know how to cook, so I enjoy that part of process as well.
If you can steam your vegetables, that is better than cooking your vegetables. You can
Yeah.
steam and you can eat.
Sometimes
What about grilling a vegetable?
What is your favorite vegetable, Kim?
Oh, so I've always loved carrots, but if I grill a vegetable, I love squash or eggplant, like the thin eggplant,
Eggplant
not
is
the
good.
big one,
Yeah.
the thin eggplants. So yeah, and spinach. I love spinach. Goes with everything to me. Spinach is a good raw cooked.
Capsicum is also good. I mean, you can have
The
capsicum with
spinach, all vegetables they are good. Even the mint, spinach, capsicum, broccoli, cabbage, Chinese
I love
cabbage,
it
everything is
all.
good.
But I love to grill vegetables, like to just sear them on the grill, just a little bit. They have a different flavor to them. So,
and what you can do is you can cut the vegetables and do a little saute with a little oil and some black pepper, and then just little saute, and that will also work as well.
Just a little bit of oil, salt, and pepper. I like to pick them out of the garden and just eat them raw out of the garden, like green beans. They, people cook green beans, right? We cook and cook, but I love to just eat them fresh out of the garden. I mean, it's just they have a sweet flavor.
In India, we used to cook the green beans. Yeah. We always cook the green beans.
We do too here, but they actually have when they're raw, they taste really sweet. Almost like a sugar.
They're crunchy,
Very
they're crunchy also.
Very crunchy. Yeah. So, but
do you consume radish there?
Here?
Yes. Yeah. Do you consume radish also? We always take radish. Yeah.
Radish
in salads. In salads also.
Because radish, carrots, these are the fruit we just buy it and just have it.
Like an apple. You eat them like an apple because they're crunchy. They're crunchy that way. Yeah, and I like beets. A lot of people don't like beets, but beets are high in nitric oxide, and
we always take beets. Beets, carrots, radish. Yeah, they're part of the salad.
I never thought about
very rich in iron. Very rich in iron.
Yeah.
And I'll tell you. I mean, in most parts of India, I mean, tomato is like a queen of the veggies. We used to have tomato and all the vegetables.
Tomatoes. So somebody one time told me that tomatoes are good, but they're not the best fruit for us. But I love their flavors. I love the flavor of a tomato, and the color is, just brings out everything. But I'm a big tomato fan. I think, and I like it, everything in their natural form. I only dislike one vegetable, and that's peas. I don't like peas. But I will eat just about anything else. Even cake.
I
had
peas today.
You had peas.
I had peas today. Yeah.
But Dr. Sugu, I think the peas is having a good amount of protein as well. I mean, if you have peas, that's also good for
peas. They are good.
Peas are good too. I just don't like them. But I can't. For some reason, I just can't eat a pea. But I can eat anything else. That's what I tell people. And I like onions, but they don't like my stomach. For some reason, they upset my stomach now. I used to eat them younger. When I was younger, I would eat a whole onion, like the big ones. They're sweet. They were sweet to me, but they upset my stomach now.
Sweet onion, yeah, sweet onion. They are very good for hair also. For the hairs, the onions are very good. Even some apply the juice of the onion also in the root of the hair. So that is good for the hair growth.
Wow. Well, I know that it's good for flavoring food.
And Kim, apart from vegetables, we used to have a lot of kidney beans, chickpeas, and things like that. Lentil and chickpeas. Yeah, and I think Dr. Saggu loves chickpeas.
Do you like chickpeas?
Yeah.
I like chickpeas. I do like chickpeas because you can blend them.
Yeah.
And make a dip out of them. They taste very good in soups.
We don't blend them that much. We just boil them and use with some spices and vegetables, and there are a lot of ways to cook it.
Yeah, they're good any way you eat them. I know, again, I like them in soups. Boiled in soups. But chickpeas are good. They're healthy for you. But what we ought to do is again, Dr. Saggu said he's going to be the ambassador for all the salads. So that makes
I have a question, Dr. Saggu, if you get a chance to binge something, what would you choose?
To binge eat?
From the veggies? Anything what you say?
What about veggies? I mean, no fruit, no veggies.
Any food.
Sorry?
No fruit, no veggies.
Okay. What repeat your question, please.
So if you get a chance to binge something, and it's like you don't have to choose any fruit and vegetables, what would you choose?
I have a protein shake.
That's a correct answer, sir.
I like one chocolate also, Kit Kat.
Kit Kat. Okay.
Oh yeah, I love Kit Kat. Yeah, those are good. Those are very, very good. Very bad for your teeth too, but very good. I like that. That's something that was interesting to me today is we learned how good an apple was for your teeth, right? And how good it is for your body too, right? We always say eat an apple a day, keeps the doctor away, but it keeps the dentist away too. So apples are a very good fruit. So, I think what we need to do though, and we are doing it, is really run some good campaigns of fruit and get that going so that more and more people are eating more and more fruits and vegetables, and we've got people starting yoga and exercise classes, and this is all very good. I want my fatty liver to go unfatty. I want a healthy liver now that I've talked to you guys. I never wanted a healthy liver before. I never thought about it before, right? So that's why these conversations are good. It's bringing awareness to these things. Children need to be concerned about this too. There are a lot of obese children as well, aren't there, Dr. Saggu?
Sorry?
There are a lot of obesity in children as well today, right?
Yeah, children. Basically, the children obesity is on the higher side, and the total prevalence of children obesity is around, it varies for the ages, because it starts with neonate obesity, then it starts with the children obesity, childhood obesity, then it comes from 13 to 18 is adolescent obesity. So if we talk about from 5 to 18 years, that includes a childhood and adolescent obesity. And the prevalence is, you can you can say it was around 6% in 1990, and now it has gone beyond than 21, 22%. So now, which we have done the survey here in India, around 22% of the children, including the adolescent, they are obese. And there are so many regions are going behind. The one and the foremost is the diet. Number two is the family environment. What sort of the environment which we are giving? We are giving more screen time as compared to the sports time. So we are giving them the virtual games. We are not giving them the real games, real sports. We are not teaching them the actual portion of the meal, what should be the portion of the meal. Actually, the love we are giving to our children, that is in form of the calories. So
Yeah.
if high calories we can give to the children, and children they are accepting our high calories, then they are very lovable. If they are not accepting that, they are not lovable. So we are giving rewards to our children in form of the calories. So if you get something good from your child, you will give reward in form of good high calorie food.
And that's that's what we need to start rewarding with good foods, not candy. Good foods,
Yeah,
not I have this mental thing with Coke, right? Every time I got sick as a little girl, my mom would give me a little bit of Coke to calm my stomach down. So in my mind, Coke is a good thing, right? Coke makes
yeah.
me feel better because it always did. And as you get older and become a parent, you realize, it's the carbonation. It's, but mentally, whenever I get not feeling well, I want a Coke, not a
And
drug,
yeah,
a Coke.
So, Dr. Saggu, there are two different cases. In one case, Kim wants a Coke whenever she feels good. And on the other side, I would like to have a chocolate donut with a hot coffee with double sugar. What is benefit?
How do we break
you
that?
you have a good choice there. Your choice is better.
Your choice is way better.
Yeah, you
Chocolate.
better. Yeah.
I'm so
So
there.
80% of the children who are obese, they are going to become an adult obese. 80%,
Wow.
because this obesity will not go. So prevention is always better than cure. So we should be preventing the childhood obesity. If we can control the childhood obesity, then we can control the adult obesity. Because obesity is not only, there is a disease impact. It is not only because of the medical impact. It has an economic impact also. It will, if we are talking about the flattening of the COVID-19 curve, but we can flatten our economic curve. The economy cannot grow if the obesity grows. So if there is obesity, no economy. If you can control obesity, you can grow your economy.
Yeah, and I think that's what we need to truly focus on now is our children. It's we need to focus on ourselves too, because we set the example, right? We are the footprint for them to follow. But they need to see those examples, and they need to see it to look exciting to drink water. They need it to look exciting to eat a bowl of fruit instead of a bowl of candy and be rewarded for it. And we need to share with them that the reward is good body, is a nice, healthy, beautiful body, right? Healthy hair. Your hair will become healthier. It's like you said, our bodies are a mirror of what we eat and how we are inside, right?
I was just watching data from Texas, and in US data right now, every third or fourth child is obese.
Yep.
And
One more.
they said in Texas, if the same curve of the obesity will grow by 2030, every second child is going to be obese. Every second child. There,
That's
there would be 50% prevalence of the obesity in childhood obesity in Texas.
it's well, and if we, it's our fault if we don't do something about it as parents, as people. We need to start making policies that enforce healthier eating. We need to enforce better practices, advertisements. Like you said, I don't watch TV anyway, but when I turn it on, all I see is bad food. bad food, like and they make you feel like you need to have it. It's like brainwashing you. So we're gonna change, right, Ankit?
Yeah.
We're gonna change. We're gonna get out here. We're gonna promote. We're gonna get sports going because today is sports day, cricket day on IBM TV. We do cricket later in the day. We encourage people to get out and learn cricket. And one of the things I told someone the other day, we were talking about cricket. More people in the world play cricket than they do any other sport, probably, right? So, we're learning about that. But like you said, we're too much into our phones and virtual games. We need to get out. We need to exercise. I grew up outside. What about you, Dr. Saggu? I was outside. Yay! That's right.
Thank you. This is for you.
Thank
Yeah.
you, sir. Thank you.
Yeah.
I think watermelon is the fruit of the
Yeah.
team here.
You're also having watermelon. Yeah.
Yeah. Wonderful.
I love the smell of it.
I'm very fond of watermelon.
Just a happy fruit to me. I remember when it was, because you had to wait for watermelon season when I grew up, right? Because we only got once a season. And my mom would cut it open the first day of summer for us. That was our first day of summer. And you could smell it. I can remember.
Yeah.
It's happy memories, right?
Yeah.
But we got
It makes me happy.
Yeah, it makes me happy too. And but your whole family eats healthy, and that's the way we need to get. And we talk about the fruits and vegetables, but there are healthy meats too that we can eat. Healthy proteins like fish, right? Seafood.
Yeah. So that is the lean meat. Lean meat you can have, fishes you can have, right? So some of the lean meat you cannot have a red meat and the meat which contains more carbohydrate, more, you can say, the refined carbohydrates.
Right.
That is not good.
Yeah, we don't need to be a T-Rex.
If you're watching the news nowadays, there are a lot of fishes. If you find out that they have a lot of plastics in their body, and I think that is also not good for health.
Yeah.
Because of our plastic dump, we are dumping the plastic in the oceans, and that's how they can.
Well,
we have adulterated fishes also now. There is adulteration of the fishes.
Yeah, adulteration.
Yeah.
Well,
that is scary. People used to have a lot of. Usually in India, not everyone is having those fishes. Very few people, or maybe people living in coastal areas, they used to have those fishes around. But it's not that popular as compared to other foods. But if it's adulterated, it's not good for health.
if you learn how to grow your own food, like if you live in the country, or maybe if you even have a small piece of property, but if you learn how to do it hydroponic wise, you learn how to grow your own fish, right? And some people, they don't use the fish that you can eat to grow their gardens. They use a different kind of fish, but you can grow fish that you can eat, as well as it fertilizes the food that you eat, right?
Yeah.
So there is a system that you can get to start growing your own food, including fish. I'm not fond of cleaning my own fish and cutting it. I like to go to the market and buy it. But it is healthier for you, I think, if you can grow your own or raise your own, because then it doesn't come from a contaminated water. Because I feared that too for a long time, the contaminated waters, and we're eating the fish from contaminated waters. So
yeah,
we got to be careful.
And then you have a lot of chemicals here.
Yeah, exactly.
And we should also discuss about what happened in Hyderabad, where we have a fish is like a medicine. People take it.
Yeah. Actually, for asthma, some people are there. Some Ayurvedic people are there. They give small fish to swallow, not to chew. Swallow it, and they put some medicine also inside that.
Really?
So I don't know what is the principle of that, but they give for asthma.
And Kim, you won't believe there are more than 100,000 people take those fishes every day.
Yeah.
Really?
Every day.
Is it a goldfish? Is it?
I don't know the name of the fish, but it's a small one.
And they have some medicine. something related to turmeric or something, and then they put it in your mouth.
That is very. Is it happen in the U.S.? I've never heard of this.
It happens in India.
Oh, okay. That's interesting. And we need to learn why the fish, right? Why are they using the fish? Is it just get the child to take the medicine, or is it dissolving different in the medicine? That's interesting.
I think Dr. Saggu would be aware about that, why and how.
That might be a topic we talk about during the next show. Oh, right.
Muskmelon, yeah.
I love it. I love it. That's another one of my favorites. It's not in season right now.
So it's like a Saturday fruit party at Dr. Saggu's house.
Yeah, we're having fruit salad. Fruit salads are good for you. I enjoy a good breakfast or a good dinner. Usually are my two best meals. Used to be lunch, but I don't do lunch anymore because I'm doing this. But I eat good snacks while, I'll beam out and eat some snacks. I think I'm going to start eating on the show, though. This is good habit. This is very good. And I like to eat a lot of apples. I cut them up, but I like to eat a lot of apples. They're very healthy for you. I cook with them.
A golden milk right now, a golden latte.
A golden latte. What's it got in it? What is your golden latte?
Turmeric.
Latte is good, but espresso is not good.
No, sir. This is not coffee. This is turmeric latte.
Okay, turmeric latte.
Is it made at home? Do you make it at home? You make it at home? Oh, okay. All right. It's in a fancy cup. It looks like you went to Starbucks or something.
No
Every
Starbucks.
time I see you, I go, oh, he's been to Starbucks.
I go to Starbucks maybe every day or maybe every second day, but it's been 3 months now. But I have a lot of coffee at my home. I can make different kinds of coffee.
Oh, what do you have?
Yeah, turmeric.
Turmeric. And I have lemon water. I drink lemon water every day. And
that's good.
I drink a big glass of lemon water every day. I find I'm healthier when I drink lemon water. I don't know why, but I am healthier. I don't get as many colds and everything. So I
just discuss what's happening in Delhi and what are the situations going on right now. Do you have any updated news?
Yeah, right now the news is coming. I think there is some sort of things they are being closed, and the chief minister has announced to convert the private hospitals into COVID general hospitals. So moreover, he is looking for 80% of the beds to be converted to the COVID beds. Earlier it was 20%, but now 80%. He asked all the private hospitals to convert their beds into the COVID general hospital. So I think that would impact the non-COVID patients also, because a lot of patients, they are not getting the beds. Even the non-COVID patients, severely sick patients, they are not getting the beds for their treatment. So they are getting a lot of complication because of the disease.
Certainly. And Kim, do you have any news from Nick's wife?
Oh, not yet. It's a 2-day process now. It used to be 14 days, but it's she was tested. She, I think, has moved her physicians to where I go, which is Duke Medical.
Okay.
And so and I've been told that it takes 2 full. So she's still waiting. I think it's been kind of worrying Nick a little bit. But they've just opened up all of our pharmacies, like CVS pharmacy in North Carolina. I don't know about anywhere else, but in North Carolina, you can go get a drive-through test now if you want to. They have increased the amount of testing they're doing, but they're finding, I think that there's a lot of false negatives. So I'm not quite sure if it's the test kits or, should we do the two tests, where you do the nasal and the blood? Yeah. I don't know. We're still learning about this disease or this virus, and it's two, right? There's a virus and a disease. And I do know that our community is still suffering the pain of the loss of the little girl, the 7-year-old. that died of COVID. The whole family had it. And the little girl went to school with my doctor's son. So I know it's a true story. I know it's not a fake story. I went to go visit my doctor. She treats me, and she was telling me about it. And she said, no, that's a true story. They don't know why the little girl died. So it's, we know that it can affect anyone of any age. So, and could it be mutating? It might be, right? It might be mutating into various different forms now. So we got to be careful, right? Eat right, get our livers in shape.
Dr. Saggu needs to leave now, so we have to say thank you,
Okay.
sir. Thank you for joining
Thank
us.
you so